Kadakbang sa lupa'y para akong inaalon at nalulunod sa batikos ng mundo, sa kung ano lamang kaya ko. Bigang-biga na sa mga problemang di masolusyonan agad, parang wala nang bukas. Pwede bang umiwas? Hinahanap ang sarili ngunit di nakakayanin sa ligaw na dinadaanan ko. Saan na to patungo?
Speakers from Dubai. Thank you so much to Sir Kevin Nagal for inviting our speakers, first speakers.
Yes po. Okay, thank you very much, Ma'am Mafe, for the correction. So before I actually start our lesson for today, I would like to acknowledge the two guest speakers from Prince Sultan Military Medical City, or the PSMMC, Riyadh City, Kingdom of Saudi Arabia. So please welcome Ma'am Kathleen Ann N. Cipriano, RN, USRN, and Catherine Joy N. Cipriano, RN, USRN, and they are both psychiatric nurses of the said hospital. Ma'am, please open your camera so that you will be known by our teachers in Kalibo too.
Hello, good afternoon mga teachers.
Okay, thank you so much. That's Ma'am Kathleen, I think.
Guys, hi. Good afternoon po.
Okay, Ma'am Joy is also there.
Thank you
Yes,
for
thank
inviting
you.
us po.
Thank you so much, moms. So I would like to ask the two of you to please turn off your camera first so that we
Yes,
can
sir.
have.
Hi, good afternoon.
Yes, thank you. All right. So today's topic is actually very timely, and it's actually related to our research, no? Together with Ma'am Abby Joy Isaran, the principal of Calibo Elementary School, as well as our principal here in Calibo Integrated Special Education Center, Ma'am Wilma Virgin Villa. So I actually titled our presentation for today as Project Padayon, or Project Hashtag Padayon, a mental health awareness seminar. So the name itself is actually derived from the Visayan term, which means to move on. No? So let's take a look. As you could have noticed, the statistics of mental health problems here in the Philippines is slowly rising. I should say it's not really slowly, it's dramatically rising. And it's like the problem nowadays is that one psychiatrist would actually cater to 250,000 Filipinos in the Philippines. And that is actually quite not good, because even in the community health nursing, we have 1 is to 40,000. And for a psychiatrist, that's a lot of people to take care with. Okay? The good thing is that in 2018, the Republic Act number 11036 was promulgated, which is an act establishing a national mental health policy, and that is actually catering all Filipinos worldwide. Okay? By the way, teachers, can you see my screen? Can you confirm po?
Yes, sir.
Okay,
Yes,
thank
sir.
you so much. All right.
Yes, sir.
So when we say mental health, what comes into your mind? May I ask somebody here who can open their microphone and answer? Sir Aljon? Sir Aljon Arevalo.
Yes, sir.
So, kapag inambay natin, sir, the mental health, what comes into our mind, into your mind specifically?
For me, sir, when we say mental health, it has something to do with do state it aton nga cognitive domain
Mhm.
aton brain. It has something to do with the functionalities of our brain, sir, and how we
Okay,
adapt
very good.
with sa atong palibot, sir. So yun,
Okay,
akon sir nga.
exactly. Okay. Thank you so much for that, Sir Aljon. And I would actually say that Sir Aljon's definition of mental health is quite good. But let's have a more detailed and more simpler or a simpler form of its definition. When you say mental, no, it pertains to the mind. And when you say health, it refers to the working order. Thus, we can simply say that mental health is the working order of the mind. So therefore, kung normal the imong thought process, of course, your behavior will also be normal, as well as your speech and your attitude towards life. Now, the more detailed definition of mental health, according to the World Health Organization, is this: it is a state of emotional, psychological, and social wellness evidenced by satisfying interpersonal relationships, effective behavior and coping, and positive self concept and emotional stability. So, if you could have noticed, all of these pertain to the fact that your mind should be in sync with what is real. So, what is in reality. And because you are in real situation, you will be able to have satisfying relationship. So, not necessarily boyfriend or girlfriend. Kasi yung iba yan, no boyfriend or no girlfriend since birth. So, in that instance, sa kugang nga giro aton nga criteria for being considered as a mentally healthy individual. We are pertaining to a lot of interpersonal relationship. It could be your family relationship, your friend relationship. And the good thing about this, it has been specified that we have effective coping mechanism because we will discuss later on that stress is everywhere. Sa bagay, sa school, anywhere there is stress. Okay. Now, according to Marie Jahoda, here are the criteria for a mentally healthy individual. First, as good self attitude. When we refer to that, it pertains to the fact that you accept yourself, no? Regardless kung ano man imong kapintasan, you accept it. Your weaknesses, your strength, you accept all of those. Next, what about personal growth? It pertains to the fact that you are willing to learn, unlearn, and relearn something. And it is evidence now sa mga participants iya sa aton nga seminar as of the moment because of the fact that all of you are willing to learn, unlearn, and relearn. The third one is about integration. We refer to integration as the fact that you are able to tolerate things that are uncertain. Like, for example, you will not be able to predict what will happen to your day. No? Like, paggawa mo, okay, gut arutanan, tapos nakatapa ka tae bigla sa dagan. Of course, that is something that we could not predict. And because of that, we should tolerate what happens, no? Hindi nga sipa-sipaon lang naton do tae sa dagan. We can actually do something by going back home and then clean your shoes or something like that. The fourth one is actually autonomy or independence. So when you say autonomous, a person can make his own decisions. A person is able to decide what to do and what to actually what to choose in everything, no? Hindi nga for some people who are very much clingy nga hindi sa naka-decide kung uwaro anda nga kaibahan. Ma-attend baga ako seminar mo karon? Ay depende sa ako mga friends kung ma-attend sanda or hindi. So you yourself should have your own decision. Third one, the fifth one, I mean, is accurate perception of reality. So kung may aton iya mga nakikita nga mga hindi dapat makita, then that's a problem. We can actually have hallucinations, illusions, and delusions. And if you have those, your perception of reality is affected. So, how do we know if something is real and something is an imagination? It's very easy. You just need to ask other people if what you are seeing is real or not. Okay? Next, we have mastery of one's environment. Of course, being a teacher, I know for sure that most of us already mastered the teaching learning processes. And with that, I can actually say that you already mastered that certain environment. However, like any environment, we have a lot of environment and we need to master all of those in as much as possible in our capability. Now, according to Marie Jehoda, once an individual has problem with all of these or at least three of these, automatically an individual is considered as mentally ill or mentally unhealthy. Okay, so what therefore is mental illness? According to psychiatric books, it is a mental condition that has negative effect on the way an individual first thinks, second feels, and lastly behaves. So, kung hambay natin kay Einar, mental health is the working order of our mind. On the other hand, mental illness is therefore the mind is not working properly. But that is not just the limitation of that definition. So there are three aspects na dapat natin makita. First is thought process. How an individual thinks, that is thought process. So if there are delusions, like you believe nga ikaw tama na si Darna, nagpambuo-buo ka ng inaiting hollow block, tapos gintugon mo ra hollow block, ang magsinggit kat Darna, then of course, that is a delusion of grandeur. Or gulpi kat imo nag-agto sa isa kang kakulto, ag naghambal-hambal ka nga ikaw or appointed son of God, then that is also a delusion. And because of that, one per or you can be classified as having thought disorder. Okay. Now, what about feeling? This pertains to our emotion. Okay. This pertains to our mood, our internal feeling. So, feelings like sadness, feelings like happiness, or joy, or anger, they are actually quite normal. But in excessive states, such as too much sadness, it's already depression. Or too much nga very happy ka in that instance could be considered as mania. What about behavior? Well, manifestations of thinking and feeling actually reflects on your behavior. When you are angry, well, it will actually show on your violent behaviors. When you are having thought process problems, it will show on how you see and perceive other people too. And that is behavior. Okay. Question. Is mentally unhealthy individual the same with mental illness? May I ask Sir Jester Nadura? What's your answer to this one, sir? Is it correct that we can say that it's equivalent nga mentally unhealthy and mental illness are the same, are one?
Hello, sir. Good afternoon.
Yes po.
Maybe, sir, it's not the same.
Okay, thank you so much for that, Sir Jester. So let's define the two of them. Okay? So hambay natin kay namin, mental illness is the fact that you are having a problem, no, with regards to your feelings, behaviors, and so on. Now the same thing with being mentally unhealthy. You have those problems too. However, when we say mentally unhealthy, take a look at this picture or this diagram. Okay. So mental health is in this side. This is actually called a continuum of our health and illness continuum. So stress is everywhere, whether you are mentally healthy or mentally ill. Now, where does mentally unhealthy is being placed? Being mentally unhealthy is you are here in this continuum. Okay? You are here. You're in the borderline. The symptoms or behaviors are not entirely enough for you to be considered as having a mental illness. So question, can you still go back to being mentally healthy? The answer is yes, of course. So therefore, you can become mentally healthy and mentally unhealthy at some point in time. And that is quite normal. What we are trying to prevent here is for us to progress to mental illness. Okay? Now, we talked about stress. Here, stress and anxiety is being differentiated. Kapag hinambay natin nga stress, anything dun mo that cause anything that cause problems with your body, whether it's physical or psychological, and the things that cause these stress are called your stressor. Now, if a stressor would actually cause problems or negative adaptations, then we can say that you are having a distress. Distress. On the other hand, if the stress is making you improve, like for people with who are mentally healthy, like tawan ka man na it assignment kay imo nga school head, no? Then you are able to improve, to grow professionally and personally, then of course, we call that stress as eustress. Eustress. That is eustress. Now, what about anxiety? Anxiety and stress are somewhat the same. The symptoms are actually the same, no? However, anxiety is also known as fear of the unknown. Why? Anxiety exists because you don't know what you are fearing about, the uncertainties. So, anxiety disorders exist because you don't know what you're anxious about. Example, habang nagahugas ikaw it pinggan, nabasag ro pinggan, kinubaan ikaw. In culture-bound syndrome, we call that as kutob. No? So, that kutob actually signifies that something bad is happening. So that actually causes anxiety. We don't know what really makes us feel that kutub. However, it is actually making us feel uncomfortable, and that is anxiety. So, ang stress gali, we can say nga sayod naton kung ano ro cause. While anxiety, we really don't know the exact cause. Okay? Or sayod naton to cause na duga ron pero inagihapon the feeling. Okay? Question, what causes you the most stress? Okay, abi, pag-print it module siguro or mga sabat. Sir Alan, would you mind telling me what do you think or what are the things that you can identify as the things that cause you the most stress nowadays? Sir A? Hello? Sir A, wala. Okay, let's ask another one. Ma'am Yuri, are you here po? Ma'am Yuri?
Sir?
Yes, ma'am. So, as you can see in the slide, can you answer the question? What causes you the most stress? Hindi man
Ah,
pagsabta nga ako, ha?
ikaw, sir. Yeah. Right now, health it akong baby boy nga doggy kasi may sakit imaw. So, nasi-stress ako sa nga cholecystitis. That's
Ay,
it.
wow. Ugoperahan tayo mo nga ayam, ma'am.
Maybe. Kaya nasi-stress ako.
Okay. So, well, as you can see, no, may stress si Ma'am Yuri sa anda nga bagay. But ma'am, can you also confirm that you also have stress here in your workstation too?
Ayan. Dyan sa school, sir. Of course, sir, when mag-preprint, naghahabol ng deadlines sa mga modules and such, that also causes me stress.
Okay. Thank you very much, ma'am, for your answer. Now, let's confirm those, no? Actually, according to the recent statistics, here are the top causes of stress, no? So we have for Filipinos, pinakamataas ged, we can identify here are job or studies, no? Their occupation, no? Occupational stress and studies. No, others we have here, no? Health reasons, okay? The second, if you could understand here, we have traffic. Daya gino pinaka-common. I think most people who live in the NCR answered the question, no? That's why traffic is here. And the third one is finances. Siguro galingin man aton nga ulo, let's say 5,000 lang da aton nga sweldo, tapos may utang ka pa nga 4,500. So paano naton pa igo-igo on the 500 pesos in a month? So that's why we have to learn to adapt to those situations. Okay, so some causes of stress are as follows. No, you can actually check them. Now, question: Hey, ano gid ko may stress? Well, stress leads to illness if we cannot go back to normal. No, so what happens when we have stress? Dahil pwedeng matabo. Pwede nga ro anxiety nimo nga mga problems or anxiety nga responses iti mga gawas dumatabo, which is fight or flight response, or it will signal the alarm reaction according to Hans Selye, no? So the alarm reaction will signal your body, specifically your hormones and your nervous system, to produce the mga stress hormone, and that includes your cortisol, your aldosterone. And the problem with these two, they are actually immunosuppressants. Dahil atong ginatao kung may una nga asthma, no? Ginasuppress na naro immune system. At kung suppress na inyong immune system, you are prone to diseases and infections. Now, what about if the anxiety reaction is generated? So you will have fight or flight response, no? And in the fight or flight response, take a look, no? Tanan nga mga vital signs mo nagatilinaas. We have blood pressure, heart rate, your blood sugar also increases. And these can actually become very much, the person is susceptible to diseases. Okay? So what do we need to do is to stop at the stage of resistance, no? Kung siin kita, we will be able to go back to our normal stage before our body will go to the stage of exhaustion. So, what are the signs and symptoms of fight or flight response? So, when you say fight or flight, permi natong ginahambal, the mga adrenaline rush. Now, let's say, nasusunog ro sang kabagay, and then, nakita nimo ito, gulpi mo gat ana nga nahakwat or mga gamit sa bagay nga mga usually hindi mo mahakwat. Like refrigerator, no? Alin pa mga mamugat kama, ano pa, katre, component, or kung amat na bit mo ro second floor it inyo nga bagay, no? So that is fight, no? So that is the adrenaline rush nga ginatawag. Now, during fight responses, it can be like angry outbursts. In which case, you will actually shout, no? Like for example, the P word, no? Or the Y word that we have. We also have violence, no? Sometimes because of that. Fight can also look like this. You bully other people because you are stressed. So gusto mo, ma-stress man ng mga tao sa palibot. You also attack something unrelated about somebody, no? So, usuyan mo gid lang ang imaw itsara. And that is actually the subtle way of using the fight response. Now, how about the flight? The flight response would actually be like anxiety or panic attacks. So, gulpi ka nagakurog sa binit, wa gahugag, or pwede man nga sige rin imo nga tilinikang sa binit, no? Gusto mo mag-ihi, pero hindi mo maobra kasi ginatamad ka, no? The tamad in the fact that you are having attacks. Flight can also look like this. You become workaholic. So, siguro, tanan kita kapag na-stress man ang ikaw sa bagay, agto ka sa school, agito ka magpatrabaho, no? You try to become perfect. Sometimes, the complete opposite of workaholic is being procrastinator. So, mga ginaobra mo karon, hinaaga mo lang obrahon kasi mahampang kaanay kung ano man ang hampangon. Or, may mga naga-chat kimo, you need to answer those, but you ghost them. Okay? Now, what about freeze? No? Freeze And fawn actually happens to people who are depressed because of stress. So it can look like this. No, freezing is like you isolate yourself, wa ka naga guwa-guwa, wa ka istorya sa ibang tao. And sometimes it leads to extreme depression. Freeze can also look like this one. You're you feel that you are not there, no? You are in the office, but your mind is not there. We also have brain fag or brain fatigue. Hindi kaluting kapamati sa ginahambal ko iba. Kumbaga, hay mental block. You feel tired all the time, no? Every day masuod ka sa school, kapinang huyab ka lagi because of that. Okay? Now, what about fun? So, it's like you please everybody. Wa ka na ila nga masakit rupa matsyagan it ibang tao. That is people pleasing. You are unable to live abusive relationship because nakubaan ka nga maging alone or hiaywanan. So, this is actually true for people who are battered by either their husband or their wives. Mind you, may mga husband man nga battered. Okay? Fawn can also be like this one, self-destructive behavior. Nagailininom at kung ano-ano man yung mga bagay such as gin, no? Beer, pero mga palahilong. So, what else? Lack of boundaries. Masyadong clingy. Bisan sino, bukod na kakilala, sige anang kup-kup ito. And sometimes they are doing sex, no? Also, inconsistency, no? Right now, love ka na na. Afterwards, bukod ka na at love. Very inconsistent. Doon na nga pagtratarki mo. And that actually happens within the day. Okay? Now, these are the things that usually refer to how people react to trauma. But it can be a sliding scale. So, pwede sila maging fight or flight. It depends. But at the end of the day, there are different ways people have learned how to deal with stressors growing up. And what we need to do is to spot and understand these responses. Now, if we can understand them, even if they are small, we can better understand other behaviors as well. And we can easily find kung sino ro naga-undergone is severe nga stress. Okay? Why? Because stress may cause the following, no? Hair loss, no? Sino nakakalbugon iya? Headache, no? Perminga sinakit imong uwo, pero wa man it reason. Asthma, weight gain, and so on and so forth. Now, what are the tips that we can do for stress management? Now, in Project Padayon, authored by Ma'am Abby Joy and Ma'am Wilma and yours truly, we will be providing some of these stress management techniques. But you can also do the following, no? Manage your time wisely. You can also meditate, such as yoga, no? Or you can just listen to music. I really utilize this one. And spend time with nature. Kung masyado naman ng mag-aoy sa DepEd, you can go to Boracay, no? But hindi man siguro dapat during your work schedule, no? Weekends or holidays lang. Always think positive in as much as possible. Of course, you have to vent out your energy by exercising. The best thing about this is in our institution here in DepEd, we have a lot of friends, no? So you can talk with friends and colleagues about your problems, no? Pero kung the problem is your colleague, actually it's better to talk about it also with with another person, no? And finally, some people would go and rely with reading books. So some other form of stress management are as follows. Okay. So why did we talk about these? Because, severe level of stress leads to mental illness. And mental illness may include symptoms of depression. This is an example of mood disorder. And depression may lead to suicide. Okay? So here are examples of people who are undergoing such problems, no? So if you could have noticed, if you have a lot of stress, no, it's in the severe stages, you will have ideation of killing yourself, thoughts about death, and so on and so forth. Magul pinagtambok, gul pinagniwang, no, they are actually stressed. Okay, let's watch this one.
Depression is the leading cause of disability in the world. In the United States, close to 10% of adults struggle with depression. But because it's a mental illness, it can be a lot harder to understand than, say, high cholesterol. One major source of confusion is the difference between having depression and just feeling depressed. Almost everyone feels down from time to time. Getting a bad grade, losing a job, having an argument, even a rainy day can bring on feelings of sadness. Sometimes there's no trigger at all. It just pops up out of the blue. Then circumstances change, and those sad feelings disappear. Clinical depression is different. It's a medical disorder, and it won't go away just because you want it to. It lingers for at least 2 consecutive weeks and significantly interferes with one's ability to work, play, or love. Depression can have a lot of different symptoms: a low mood, loss of interest in things you'd normally enjoy, changes in appetite, feeling worthless or excessively guilty, sleeping either too much or too little, poor concentration, restlessness or slowness, loss of energy, or recurrent thoughts of suicide. If you have at least 5 of those symptoms, according to psychiatric guidelines, you qualify for a diagnosis of depression. And it's not just behavioral symptoms. Depression has physical manifestations inside the brain. First of all, there are changes that could be seen with the naked eye and X-ray vision. These include smaller frontal lobes and hippocampal volumes. On a more micro scale, depression is associated with a few things: the abnormal transmission or depletion of certain neurotransmitters, especially serotonin, norepinephrine, and dopamine, blunted circadian rhythms, or specific changes in the REM and slow wave parts of your sleep cycle, and hormone abnormalities, such as high cortisol and deregulation of thyroid hormones. But neuroscientists still don't have a complete picture of what causes depression. It seems to have to do with a complex interaction between genes and environment, but we don't have a diagnostic tool that can accurately predict where or when it will show up. And because depression symptoms are intangible, it's hard to know who might look fine but is actually struggling. According to the National Institute of Mental Health, it takes the average person suffering with a mental illness over 10 years to ask for help. But there are very effective treatments. Medications and therapy complement each other to boost brain chemicals. In extreme cases, electroconvulsive therapy, which is like a controlled seizure in the patient's brain, is also very helpful. Other promising treatments, like transcranial magnetic stimulation, are being investigated too. So if you know someone struggling with depression, encourage them, gently, to seek out some of these options. You might even offer to help with specific tasks, like looking up therapists in the area or making a list of questions to ask a doctor. To someone with depression, these first steps can seem insurmountable. If they feel guilty or ashamed, point out that depression is a medical condition, just like asthma or diabetes. It's not a weakness or a personality trait, and they shouldn't expect themselves to just get over it, any more than they could will themselves to get over a broken arm. If you haven't experienced depression yourself, avoid comparing it to times you've felt down. Comparing what they're experiencing to normal temporary feelings of sadness can make them feel guilty for struggling. Even just talking about depression openly can help. For example, research shows that asking someone about suicidal thoughts actually reduces their suicide risk. Open conversations about mental illness help erode stigma and make it easier for people to ask for help. And the more patients seek treatment, the more scientists will learn about depression, and the better the treatments will get.
Okay, so that is actually a brief and very detailed exemplification of what depression really is. Now, take a look at this person. She looks happy, however, she's actually suffering from depression, no? And if you could have noticed, no, people who have depression really don't show it, no? May una nga ginatago, and some actually notice the changes, those who are actually close to them. And if you are really close to these people who are having such changes in behavior, it's time to ask them questions. Do you have suicidal thoughts, or do you have problems? No, we can talk about it. Okay. This person, no, daya do nga nga nagpakamatay because of modules daw, no? But of course, depression is multifactorial. Wa lang dun imaw it sangka major nga cause. May una nga maka-trigger, no? Nga dato gid pinakamabugat nga nag-cause ko ana nga depression. But the thing is that depression is eclectic in a sense nga kabaabo imaw nga mga factors surrounding it. Kumbaga tanan yung mga stress, nag-ilimaw, nagdugungan, and that actually exhausted your body and your mind, leading you to having the mental disorder. And well, it's actually pressing nowadays and it's very timely. No, last year we have one teacher who died in Tacloban because of suicide. We also have in April last year too. No, we also have one from Banga at a nurse who actually had a suicide also. More recently, we have a SPED teacher, no, here, and it actually garnered a lot of issues in the past few days. And I just really don't know, the trend is really increasing. Even Miss USA, Chesley Kirst, um, committed suicide, and it's really so sad. Okay, so what are the things that we need to talk about, no, about suicide? Now, is it dangerous to talk openly about suicide? People at risk either want help or they don't want help. People who are serious about suicide cannot be helped, and only professionals can deal with suicide. All of these are myths, which our speakers later on will elaborate. Okay. So suicide is the act of killing oneself, and usually it's associated with grief and depression. Okay? Suicide is very common nowadays. Here are the statistics. No? This is the second leading cause of death between 15 to 29-year-olds, because during this time we have maturational and situational stress. So what are the warning signs of suicide? So take a look at the following, no? In terms of how they talk, they would actually say, permisin ng burden to other people. Hey, buliga, ano ako karaya ko? No? Or something like that, yung pinaubra lang. Sometimes, they have thoughts or speaking, ay, kanami siguro magpakamatay sa doyon nga lugar. Kanami siguro nga sa kwarto ako magpakamatay. They also have talking about, hey, pero may aga sinakit akong dughan, akong ulo, akong likod, no? What about their mood? You will actually see that they lost interest. They are irritable, no? So, and the opposite, sometimes they have rages. For behaviors, they usually withdraw from doing activities. They just stay at home, no? They either sleep too much or too little. So, either of the two, kumbaga opposites, no? The extreme opposites, eating a lot or eating less, something like that. Okay, so here are some of the suicide warning signs. I want you to take a look at them. No, so what can we do to prevent them is to identify those thoughts. So based on the following, so watch out, no, for suicide prevention, we have to have this mnemonic, which is wait. Watch out for signs of distress and changes in behavior. Kung gulpi ang imo nga dating masadya, gulpi naging sad, no? Second A, ask, are you having suicidal thoughts? So you have to do this, no? If you will see that person, ask them directly. Okay? May myth kita nga hindi paghambagon dahil ginatawa mo't idea imaw, but the thing is no. Okay? Also, it will pass. Just like anything else, suicidal feelings will always pass with time. So that's why we need to prevent that from happening kasi it will pass. And lastly, talk to others. Encourage your loved ones to seek help from a general practitioner or health professional. So how can I help someone deal with suicidal thoughts? Okay? So communicate with them so that they feel appreciation and care. Give them time to reply and express themselves. no, in as much as possible. Always be there. Now, protect them from anything that may cause harm to themselves. So, if you know that somebody is going to kill themselves, has plans to kill himself, ipalayo lagi imo sa mga bagay nga pwede nang gamiton. Pwede mo i-ask imo, ano rin imo nga plano? Paano ka magpakamatay? Usually, very detailed ang nga plano. So, hambawa na nga gamit imo lubid ag mapakamatay sa school, taguon mo lagi yung mga lubid nga pwede nang magamit. Okay? Stay with them as much as possible. Usually, may 24/7 gid imo nga bantay. And finally, very importantly, express your support and love. The good thing here in the Philippines is we already have the suicide prevention hotline. So, call 804-4673 for hope. And always remember, gaano man kahirap ang buhay, live. Because life is beautiful. That ends my discussion. We will go to the part two of today's topic with a question and answer portion with our esteemed guests who are psychiatric nurses, registered nurses from the Philippines, the Kingdom of Saudi Arabia, and U.S., United States of America. They are a graduate, or they are graduates of Bachelor of Science in Nursing at Aklan State University, batch 2010. They are now psychiatric nurses at Prince Sultan Military Medical City. They are NCLEX registered professional nurses and also Saudi Commission for Health Specialties registered. Multi-talented individuals. Sandang kambal, no? Ginatawagin naman mga multi-talented during their high school days and even in their college days. Mayad makanta, mayad madeclaim, mga maalam. They also have basic cardiac life support. They are basic cardiac life support provider and dedicated psychiatric nurses. So without further ado, let's all welcome our esteemed guests for today, psychiatric nurses from Kingdom of Saudi Arabia, Kathleen Ann Cipriano, RN, USRN, and Catherine Joy Cipriano, RN, USRN. Please give them virtual rounds of applause.
Hi, sir. Thank you good sa introduction.
Yes, mga ma'am. Please
Good
open your
afternoon
camera
sa
po.
tanan.
Ma'am Joy, Ma'am Ann. Good morning.
Hello.
Good morning, ina kinyo.
Oh, yes, sir. It's still 9 a.m. po. In the
Okay.
morning. 5
Hi,
hours.
sir.
Kasi
Hello po, mga
kan ka mo, mga ma'am and sir, ha? Kambal da aton nga
Yes,
mga
sir.
guest
9 a.m.
speakers. Okay, if you have any question, you may raise your hand digitally, no, sa aton nga teams so that you will be accommodated. Ma'am Rena will allow the microphone on your end. So let me begin our questions for the two of you. Although na-discuss na kaina about stress, no, in general, but would you mind telling us any idea about stress? What can we do? Where can we actually ask for help if we are in distress? Let's ask Ma'am Catherine Joy first.
Um, the stress is really a natural emotion that we usually encounter in our daily basis in our life. It's really unavoidable. Kaya di kita mamadua sa pangadlaw-adlaw nga makabatsag kita stress. Like example, we feel anxious, frustrated, angry nga hindi naton gid in a certain situation or circumstances nga na-experience naton.
Okay, thank you so much. Ma'am Kathleen Ann, do you think nga as a psychiatric nurse, you are immune to stress? Or are nurses immune to stress
No,
or healthcare practitioners?
uh, no, of course not. Wagid pinayabi kung sa tanan nga tao, tanan gina-stress. Even pagbugtaw naton sa agahon, iniisip naton kung alin matabo sa atong adlaw. Do yun gid stress sa pangadlaw-adlaw naton. Karon ga umpisa.
Okay, thank you. Ma'am, pwede naman makita kung gwapa gid ikaw nga mayad. Kung gayon ning itsura kay Ma'am Catherine Joy.
May mga
Okay. Thank you very much. Okay, next question. Well, are stress-related disorders really common during this pandemic? In your experiences as a psychiatric nurse, nag-inabo kaya do ato mga patient nowadays because of the COVID-19 due to stress? Sino
Yes,
mas?
sir.
yes,
Because,
definitely.
Okay.
kasi
Why
hay,
do you
na
think
ano
so,
sa,
Ma'am Ann?
kasi nag-ano, di ba, stay home what asandag. Even kaibahan do pamilya sa bagay, tapos na-restrict sanda, ro environment ay restricted man gihapon. Siyempre, ko amat, di ba, naboboring kita gita. Do yun, stress git aro dayang pandemic na nahadlo kitang matap nun it COVID,
Uh-huh. So,
kuwang do
any
socialization
thoughts?
sa mga friends.
Oh, yeah. I really like that idea. Can you elaborate further about that, Ma'am Catherine Joy, about
Um,
stress because wa kita at association with friends?
yes, example, because sa tanan man hay, we need socialization sa guwa. Kailangan nato physical contact. Usually abi nasanay kita before nga perming kaibahan atong friends gamit ga example gakaon sa guwa, we have activities nga pwedeng obrahan sa guwa. But because of the pandemic, na-restrict gid kita tanan, then kaya sometimes no tawo nag-iisip kailan hinno matapos do pandemic, hinno maton ma-experience dayat uman. Kasi it's almost 2 years yun, kaya siguro ginausi-usi man kaaton nga gawa sa piniino ro na obra naton before previous activity naton.
Okay, thank you. Well said. So, in regard to teachers, I think you have relatives who are teachers also, right? And you yourself are nurse educator, so you have teaching jobs as well. Would you mind telling us what are the common stressors associated with teaching that are very trendy nowadays during the pandemic?
Of course, sir, burnout. Kasi hay, di ba, ga inubra permit modules, tapos ga-print, tas taet gabi eh. Na-occupy gid your time nandait, inubra it modules, tapos ay kung siin pa mabuo it resources, kasi kapuman di ba sir gagasto it mga pang bakag it A4, it mga coupon bands, tapos mga pang print. Do yon.
Well, the good thing here in the DepEd Aklan is most of the supplies are actually covered by the fund of the DepEd. Well, sometimes we use our own money too, just to confirm that. Okay. Ma'am Joy, please tell me, what are the common examples of the disorders associated with stress?
Example, kung hindi ka ting makakope with stress, it will lead to anxiety. And like what you discussed, sir, anxiety and depression, general anxiety disorder, panic disorder, the most anxiety nga ma-feel isang katawo. It's like intense fear and karon do gasudo palpitations, headache, severe headache, chest pain, social anxiety disorder, and sa specific phobias, and what you call that one? Maybe that's it. Five only.
Okay. Well, Ma'am Ann, we were talking about Ma'am Ann, are you still here? Okay. We were talking
Yes, sir.
about stress earlier, no? But could you actually consider stress as a normal thing anywhere, everywhere? or stressor in general?
Yes, sir. It's a normal thing gid sa tanan. Stress is everywhere, anywhere, and anyone can experience it and feel it.
Okay, thank you. So it's really a confirmation nga we cannot really avoid stress in general because it's everywhere. It's ever floating, right? So, well, what are the extreme nga mga posibleng matabo or symptoms of early stress, and what can we do to prevent or to cure them? Ma'am Joy?
Like disturbed sleeping pattern, example di ka makatug sa gabi iit inisip kung paano
Correct.
masolusyonan di imo nga problema. Then yun, as you mentioned sir, sudden outburst of emotion, permi kang naakig, permi kang irritable, hindi ka maka-function it mayad sa imo nga trabaho, then permi kang nagaoy. Kung makabatsyag ka it mga makarang symptoms, example for me, personally, permi akong ga deep breathing, permi akong ga ginhawat madagom. Kasi karon ga relax imong gawas. Kaya
Wow, thank you for
karon
that.
ga kalma.
So deep breathing exercises, no? It's really
Mm.
effective on your end, ma'am.
Effective. Mm.
Okay. Well, people here in the Philippines are afraid to seek consultations, no? Especially sa psych, may stigma, no? Nga kapag inambay nga,
Mm.
ay, ikaw mangon, nag-agtoy mauna. So, what can you advise about such things, no? If they see symptoms, what should they do?
Kasi grabe abid do stigma una sa aton kasi wasa nat mental health awareness. Hindi siya do ibang tao hindi like sa community may ibang tao nga hindi sila masyadong knowledgeable about mental health. Kaya may stigma git affirming gagawa. And kaya kailangan git ang verbalize ka it imo nga own thoughts and feelings, especially kung side mo nga ma-trust mo ding tao, and komportable ka mag-verbalize it feelings sa diyong tao.
Okay, thank you. Now, we actually talked earlier about stress, and we already established nga it's a normal thing. It happens everywhere and anywhere. So, as a response, some people would be angry or some people would cry. So, do you think it's okay to shout, to yell, to cry, or to vent out your feelings in general?
Yes, it's okay. Sometimes yelling, being angry, crying, it's like a cathartic feeling. Ipagawa mo gid imo nga nabatsyagan. And sometimes after that one, parang naghagan-hagan imong pamatyagan. Pero syempre piliun mo man di mo nga singgitan, akigan kasi base do yun nga imong nasinggitan ag naakigan may nabatsyag man may stress man
Correct.
nabatsyagan ag i-take nanda as very bad man kanda ron.
Exactly. So it's better no kung mga known mo ro mga tao, is that right?
Mm.
Na
Mm.
ginahambagan. Okay. So hindi nga
Mm.
buko mo't kilala ag tapos singgitan mo gat ato sa dagan.
Oo, di ba?
Okay. By the way, participants, if you have questions, no, please raise your hand so that you can be acknowledged. Let's go to the next questions. Ma'am, here in the Philippines, I really don't know, but somebody told me that there are groups, no, support groups or agencies that can help people who are burdened with stress. And there are even some places wherein they can just vent out their anger by throwing the porcelain sa wall. Do you think it will help?
Yes, it will help. Kasi through negative feeling mo, ma-transfer sa example by throwing the plate, ma-transfer sa wall.
Okay.
And I think that's effective imo.
Okay. There is one question here coming from Bacau Norte Integrated School. Sir Elnor, you may ask your question po.
Sir Kevin. Good morning, Ma'am Joy and Ma'am Ann.
Good
Just want
morning,
to
sir.
just want to ask about for those women or for those mothers who are experiencing postpartum. So, what can you advise to them?
What we can advise to them is kailangan na mag-verbalize feeling and they need social support, especially from the family. Kasi karon gaumpisa the treatment. Kasi kung what support from the family, from the husband, and what nakaintindi ka na, mas lalo gid ay mo nga galalaan ang sitwasyon. Actually, maabo kaming pasyente nga makaroon, kaka-discharge lang nanda.
Oh, so
Kaya,
mga acute care inyo nga patients makarama.
Oo, sir.
Okay.
Kaka-discharge
Well,
nga na at least naintindihan nyo na ng sitwasyon, nagkaka-insight sanda, napapansin namon gamay sanda dahil sa social support ko andang family, firmi sandang natawagan, agbuong.
oh, wow, nice. So, speaking of your clients, una, Sir El, you have follow-up question po?
Yes po.
Sir El.
Yun po. Thank you, Ma'am. No? So,
Yes, sir.
malaking tulong yun. Na-mention mo kanina yung damot. Ano yung damot?
Gamot. Depende sir sa natao't psychiatrist. Example kung may postpartum psychosis or depression do pasyente, ginatreatan their symptoms, antipsychotic, or kung antidepressive medication.
Okay.
So, ibig sabihin po,
Kailangan
niyang
check up with doctor kasi hindi basta-basta. Example, kung breastfeeding do nanay, kailangan gid na i-monitor psychiatrist.
Exactly. So, even do mga, kwan ma'am no, mga herbal nga ra nga, like, maka-treat ko no sanda depression, hey, we need to have doctor's order for that,
Yes,
diba?
still kasi hindi pwede nga mag-take ang basta-basta mga herbal medicine. Hindi pwede mga but-but nga kailangan gid psychiatrist.
Okay.
Thank you, Ma'am.
So,
Thank you po.
okay. Now, in regard to your experiences, Ma'am Kath, or later on, if Ma'am Ann will be available, I would like to ask, no, what was your worst experience with a patient having depression or psychosis? And what was the best, no, experience being a psychiatric nurse?
Sa worst part, sir. Because some of our patients are really unpredictable in mood and behavior. They are verbally and physically abusive to us, especially to us nurses, because we are with them 24/7. But still, the instinct as a human, ma-counter-attack gid kita kasi mas nasakitan ka. But we cannot do that kasi said namon nga may masakit sanda at kailangan treatment. Sometimes wasa na kasad sa andang na obra, pero sometimes sayod nanda ga apologetic sanda after. Ay ma'am, sorry kasi wa gid ang siisip ka kuuna nga example gapanabunot, gapangkusi. Kaya sometimes din do pinaka worst kailangan gid patience ag understanding sa mga pasyente.
Okay.
And the good part, of course,
yes.
Yes,
yes, continue po.
the good part, of course, by helping them, nga gamayad sanda, doon do pinakamanami. Kasi during admission, they are really disturbed, disorganized. Then after some time, after some days nga, wasa nagainup bugong, gina-monitor gid naman sanda nga makainup bugong. Then, example, mga suicide patient, one-to-one kita naman sanda, 24/7, kaibahan naman sanda. And, karon sanda gitagamay. Kaya parang achievement naman nga, kabulig kami kanda. Nga hindi nanda masamad anda nga sarili.
Well said, kita,
That's it.
ma'am. Well, you mentioned about 1:1 nga bantay, no, especially for suicidal
Mm-mm.
patients. Can
Mm-mm.
we also do that? If, for example, bukod akot nurse, and then can I also do the interventions that you're doing? Like as a nurse, you give out medication as ordered by doctor. Can the family member also do that, or a friend perhaps?
Yes, definitely they can do that. You should plan kasi naintindihan mo do presentation iti mo nga friend, member of family. Kaya kailangan nimo sa nakakaano ka nga ay kailangan bantayan. Mag-ano ka mo relyebo kung sakali nga kung nag-aawi ka gon kasi kamo niya every 2 hours may reliever kami. Kaya
Ay,
waman kami
nice.
na exhaust gid it may may general observation kami mga mga chronic patient yun anamon level 2 within eyesight. And then level 3 every 15 minutes for 1 hour for every hour gina-check namon the pasyente within arm's length. And level 4 doon gitaro sobra utagid nga grabe ubrahon wala tanan para magpakamatay imaw kaya dukot-dukot utagid kami kanda tanan ubrahon nanda para magpakamatay kaya level 4 gita imaw
Is
um
restraint allowed for
as a
those?
friend, yes sir,
Okay.
yes we have for mechanical restraint, and we have seclusion,
Okay.
room.
Okay. Ma'am, I would like to ask, no, what do you think would be the best attitude nga pwede naton nga aton nga toolgid baga if we have friends or family members who are depressed and who are actually kind of having some mental illness. Kasi 'di ba makaugot gid asandara kung
Mm.
kuana naton. So what would be the best
Makaugod.
attitude?
The best attitude is empathy. Dapat you put yourself to their own shoes kasi and understanding iintindihan mo andang sitwasyon nga makarasan da. Hindi mo sanda i-judge nga ay ikaw mangunin hindi ta pwede ron. Kailangan mo gid nga big understanding to them nga makasurvive sanda sa anda nga crisis. Kasi crisis man lang dun bukod mat every time makaroon anda nga presentation or sitwasyon. By the time goes by, social support from the family, medication, follow-up check-up sa psychiatrist, counseling, gamayad sanda.
Okay, that's
That's
the
it.
silver lining, ma'am, no, nga
Mm.
anybody who has mental disorder can really go back to their normal
Mm.
selves later and eventually.
Mm.
Tama.
Not 100%, but at least, di ba, sir?
Manageable.
Manageable.
Okay, thank you.
Need patience and understanding.
Thank you so much. I just want to add, no, si Ma'am Catherine and Ma'am Kathleen Ann, they are actually VIP nurses. Kasi doon nga gina-take care nowadays are mga princess and princesses
Yes.
of Kingdom
Also,
of Saudi Arabia, right? So that's why
sorry,
hindi gid
nag-out
kami
yung
makarmas.
taimaw. Oo. Kasi may appointment, Biro Princess sa Auta.
Okay.
Mm.
From the fellow school heads, Ma'am Mafe, do you have questions po?
I just wowed Sir Kevin.
Kasi may additional ka nga questions, ma'am? Or anybody from the teachers, attendees, participants?
Can we consider those who are actually uh, because we have kind of characteristic of a person who is not mingling with others and who usually just would like to be secluded to herself. Ano ni tawag naton karon Sir Kev?
Sa mga nag-isolate,
Not really, pero yung character niya na ganun
avoidant.
talaga, there's
Avoidant. Yeah.
may isang bilog pagid ang ana gid abing characteristic bilang person, the personality of the person itself nga wa bukok nimot mahilig maguwa, no? So she or he finds comfort, mas komportable nga imaugat so kasi kanina you mentioned, no, Miss Cass, that uh,
Yes,
during this
ma'am.
COVID na na era natin, the people who are trying to seclude themselves and isolate themselves from the rest, we have to take notice already of the behavior. Pero meron abi nga mga tao gimat ang personality nanda nga mas nailat na baga nga sanda nga bukon bagat paga iba, no? Nga they prefer to be working alone, or they just work uh, in their room.
Oo. Let me have a take on that, Ma'am Mav. Based on the things that you were actually saying, that is actually part of a person's personality, no? So if we can consider somebody as having a mental illness if affected anang social interactions andro anang activities of daily living. So in that case, matsawa man naapektuhan. So I do believe that that is quite normal for that person.
No.
Well, if it's in the extreme level that hindi na ma-tolerate, no, ro treatment with other people, or interaction with other people, then that's the time we can consider that it's more of a personality disorder. Right, Ma'am Catherine, Joy? Can you elaborate about personality disorders versus the normal personalities?
Kasi sari-sari abi do personality disorder. Maybe yung sinasabi mo Ma'am Mary Faith, she is avoidant personality disorder. Pero kaya na mata siguro nga imaw isa ya pero guarded yang imaw siguro sa ibang tao. And at in a positive way, hindi lang gid na kaya makipagmingle it mabuhay sa ibang tao, pero gamingle man gihapon imo sa ibang tao.
Okay.
Oo, ma'am.
Bukod niya siguro ma'am sa mga co-worker,
Hmm.
pero base sa iba matay nakikimingle matay mao. Eh di ba hindi man natin pwede i-please to everyone.
Oo. Pag choosy man
Mm.
siguro sa
Base no. May additional question pa po. Ma'am Teresa Melgarejo. May question ikaw, Ma'am Teresa. Ay, hindi kayo makita eh.
introvert, tama 'yon. May nag-message kasi. Tama 'yon. Yung introvert, Sir Kev.
Yes po. Okay. So my next question is this one. No, you actually told me about stress reduction nga coping strategies such as deep breathing. But can you suggest more nga pwedeng magamit it mga teachers nowadays during pandemic? Ma'am Joy.
Like example meditation.
Mhm.
Like be alone in some one part of your room, then meditate and just think some good situation nga mapasadya ikaw, then physical exercise. Like example, I know someone nga medyo na stress imo dayong pandemic, biking sanda ko andang mga friends. And at least do biking, what masyadong what you call that one,
Restrictions.
distancing
No?
or restriction. Kung may social distancing man ginatawag, ay malayo man imaw. And then see your friends kung
Talking
pwede.
with friends, ma'am, no?
Yeah, talking with friends. Mag-coffee ka mo, eat out, and have enough sleep. wag masyadong magpaka-stress sa module kasi matapos gid doon.
Oo. Ano
Bond
nga
with your family.
oo. Um, I was about to ask, no? So actually, talking with your closest friends, as what they say, they are actually chismis, no? So,
Marites.
so tama man kaya ron. Okay lang, no? Di ba? Mag-istorya ka with your closest friends. It's a form of coping mechanism. Am I right?
Mm.
Okay.
Mm. Yes, sir. As long nga ginatrust mo imong friend nga ron, nga hindi mapaabot sa ano yung ginachismis.
Yes, of course. Mamape.
Para di man maka-hurt its feelings.
Okay. So another question. I think I have one more question here. Can you give me examples, no, of warning sign that an individual is about to do self-deprecating behaviors, no, like they are about to kill themselves or to harm other people. So, what are we going to watch out for in such instances?
Example na first is nag-start nun sanda mag-withdraw sa ano sa mga tawo nga malapit kanda. And start nun sanda mag-isolate, and then sometimes nagabilin-bilin yung sanda, gataunit mga gamit nga importante
Pili lang sila
kanda. Like what you said, sir. And dun tapos ang specific nga way kung paano nanda obrahon nga i-mutilate andang sarili. Like that,
So,
sir.
kung nag-verbalize ang daet do yun nga ron, like, plano ko magpakamatay, so, as a person, pwede kaya naton nga istoryahon sanda about do yun?
Yes, sir. Dapat i-acknowledge natin andang ginahambal. Hindi natin baliwala no basi joke man lang dun ha. Dapat i-acknowledge natin do andang ginahambal permi. Kasi sometimes feeling mo ga-joke sanda gahibag sanda pero deep inside minatod tagalin nanda gusto nga obrahon nanda so yun nga ano bagay.
So, it's really a good thing to ask, no? For such situations.
Yes, sir.
Okay.
Yes.
Ma'am Abby Joy Isaran, may co-author in Project Padayon, is asking a question.
Yes, sir. Good afternoon. Good afternoon to Miss
Hi, ma'am.
Karen.
Good afternoon.
Ma'am
Yes,
Abby Joy.
yes. It has mentioned here now that when a person is suspected to be undergoing stress or depression, we will have to watch over them if possible. But I think we can't possibly do that all the time. So is there, ma'am, a recommended best time to be with them? And how about the advice that big person undergoing stress should have yoga or meditation? So how would they do that if all the time they say the loved ones are with them? Thank you.
Yes, as possible kailangan gid nanda tawo nga gabantay kanda. Kasi doon man lang gid the way para kung sample kung desidido gid abiro tawo go sa gasanat paraan doon para mag-suicide. Kaya kailangan gid it someone nga ano kanda permi magbantay. Pero kung hindi gid maiwasan, i-monitor nyo yung permit, tawagan, istoryahan. Example, sambitan magguwa, mag-unwind, and then kung sa yoga and meditation and exercise, pwede man na taon ni mo oras doon nga ron nga mga exercises, meditation. Or example, give them schedule nga ubahon nanda daw yun yun. At least ma-monitor mo andang na obra. That do yung time.
Thank you, ma'am.
So this is why it's really important, no, to treat, no, the people who have mental problems together with their family or their significant others. Tama, Ma'am
Yes,
Catherine
yes,
Joy.
sir. Yes,
Oo.
sir.
So syempre hindi mo mabantayan imong sarili. So who would take care of yourself if you yourself is having a
Mm.
problem, no? Okay.
Kaya gid kailangan
So
gid at family support din gid our number one.
okay. So, when would be the best time to seek consultation? If let's take a look, no. For example, ako wa man na ako family and friends who would actually tell me, "Hey, pakonsulta kaguting mo sa psychiatric doctor." So, when would be the best time for me to consult a general practitioner?
Mm. The best time nga mag-start ni ikaw magpa-consult is side mo sa iyong sarili nga bukod ko tingit productive feeling mo may self-awareness ikaw nga hindi mo kaya isaya nga i-cope imong stress or problema.
Okay.
That's the time nga mag-start ka on it o say it support from a psychiatrist or general practitioner.
Oh, thank you so much for that, ma'am. So, bale, no, the good thing here in DepEd, we have guidance counselors, no? Ma'am Abby Joy, do you still have additional questions po? Ma'am Abby? Okay. So, actually, it seems that nag-raise lang it hands. From the audience, from the participants, do you have additional questions for Ma'am Catherine Joy or Ma'am Kathleen Ann regarding our topic? Let's abuse their time for today. Okay, so seems nga wa na. I would like to thank you, Ma'am Catherine Joy, for that. Oh, we have Ma'am Angelica Jalay. Let me allow.
Thank
Okay,
you, sir.
Ma'am Jalay is asking a question. Go on, Ma'am Jalay.
Yes, yes, ma'am. Good morning. I would like to ask or seek some advice po because at my age, I am 24 na and mga line of two na mga friends ko and mostly yung mga acquaintance ko po is parang mostly of them, parang pinaplan na nila na at this age, dapat may ganito na ako, dapat may ganyan na ako. So, parang I would like to seek advice po kung ano po yung ma-advise nyo pag once na hindi na po nila na-achieve, kasi dyan po nagsa-start yung pressure, tsaka po yung stress. Pag once na may plan sila at hindi nila na-achieve at that age, parang ano na, parang kine-question na po nila yung worth nila. So I would like to seek advice po if what is the good thing to do po. Sa mga friends ko po kasi mostly ganyan po yung nararamdaman nila and they just vent out their feelings to me or share some experience and I have no idea how to comfort them. So I would like to ask advice from you, ma'am. Yan lang po. Thank you.
Okay. It's very common kita nga mabatsyagan dun it mga example mga millennials. Bisan na ako kung amat naiisip ko pero kung naisip mo nga ro life is not a race ag every day nagiging productive ka man ag hambawon mo kanda nga kahit bisan wa mo naabot makarang year maybe next year mabuo nimo and don't uh, lose hope nga di mo maabot di yung goal kasi wa man it certain time para ma-achieve tanan ro sang kabagay within that kasi may time frame sanda eh
Correct.
siguro may advice ko lang hindi sila magdali bata pa man
Exactly.
Gani, ma'am. I mean, the right
Accord,
time will come. God's
correct, Ma'am
will.
Jalay.
tanan-tanan kita may sariling timeline maton. 'Di ba? Sariling timeline.
Exactly.
Tanan-tanan kita may sariling timeline maton. 'Di ba? Sariling timeline. 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 'Di
Tama.
Yes,
And I
ma'am.
would like to add to that, no, no, hambaga ni Marie Jehoda, we have to tolerate, no, life's uncertainties. So,
Mm.
kung hindi ka man mana hindi mo ma-accept ma-achieve mo karon, maybe next time, no? But
Mm.
learn to live always. Tama, ma'am?
Mm. Correct,
Okay.
sir.
So, I think sa prinsesa, gut amo karon si Ma'am Kathleen Ann, and the patient has an appointment also. I would
Mm.
like to thank you, no, Ma'am Joy, and please extend our thank as well to Ma'am Ann for a
Mm.
very productive morning in your place, afternoon here in our place regarding mental health. And with that, I would like to give you this certificate of recognition from the District of Calibo 2. Let me read the citation. Department of Education, Region 6, Western Visayas, Division of Aklan, District of Calibo 2. Certificate of recognition is hereby awarded to Kathleen Ann N. Cipriano, RN, in grateful acknowledgement for her expertise and valuable services rendered as resource speaker during our mid-year virtual inset for teachers on January 31 to February 5, 2022 via Google Meet and online platforms. Given this fifth day of February 2022, signed Arlene I. Regalado, our Public Schools District Supervisor. Please give virtual clap or applause to Ma'am Kathleen Ann. Everyone po.
Thank
And
you, sir. In back of her. Thank you.
okay, pares man yung itsura So, hindi mo nalata.
Amen.
So, change lang ikaw its side or the same certificate is also given to you, Ma'am Joy, Catherine Joy and Cipriano, RN. We are very glad nga ginpaunlakan yung mugid ninyo ro amo na lang invitation here. And hopefully in the future nga mga endeavors it DepEd and the government agencies, we can actually use your expertise. So thank you so much, Ma'am Catherine Joy, for the time for today.
Okay. Thank you,
So,
man, sir, for inviting us and to all teachers. Thank you. Good. I hope na may na-impart man kami.
okay, a lot gidana, ma'am.
Yun.
Sir Elnor, any last message po for our guest speakers po?
So yan po, nagpapasalamat po kami mula sa puso ng Ariglado Kalibuto for sharing your
Yes.
precious time. And talagang nice to know all of that even myself I realized and I learned from that. So malaking tulong po in kahit kunting napakaganda pa sana kung ma-extend eh. Oo, kasi limitado lang yung oras, no? Limitado lang yung oras. So, maganda pa sana kung mahaba na konti. No? Pero kahit kunting oras lang, eh, malaki na ang naitulong niyo sa akin. Maraming salamat po, ma'am. God bless po.
Okay.
Okay,
Thank
you're welcome,
you so
sir.
much. Thank you so much, Ma'am Joy. Please tell Ma'am Ann.
Thank you, sir.
Thank you,
Apa,
kid.
sir. Thank you so much.
Bye-bye.
Thank you, sir. Thank you, mga teachers.
Ay, dali lang pa-picture ay ko no, ma'am.
Ma'am, and thank you, Sir Kev.
Ma'am Abby Joy, pwede pa open cam? Ay, paano kaya? What is Ma'am Wilma? Sige, let's have a screenshot lang.
Sige.
Okay, thank you. Thank you so much.
Thank you, ma'am. Thank you, Sir Kevin.
Okay, bye everyone.
Bye, sir. Bye-bye.
Kada langaw sa hangin, pansin ko na lagi na lang usok. Walang malinis, halos puro polusyon. Parang ako raw ang nakonsumisyon. ba sila? Huminga ka ng malalim at isipin ng mabuti ang mga desisyong